Hello and welcome to the Regional Health Report. I'm Ann Krebs. This monthly program highlights the world-class healthcare provided at each of our Regional Health Command Atlantic medical facilities, dental clinics, and public health units to soldiers, their families, retirees, and other beneficiaries. The area of responsibility for the Commanding General of our region is vast. One way the CG gets to know the challenges at various posts is by visiting our medical facilities. Zach Renstrom has the story of one such visit.
Brigadier General R. Scott Dingle, the Commanding General, Regional Health Command Atlantic, and RHCA Command Sergeant Major Matthew Brady joined the leadership at U.S. Army Medical Department Activity Fort Stewart for a tour of Wynn Army Community Hospital. Before the tour, Dingle took the time to meet with two of the soldiers who worked the staff duty desk at Wynn and imparted some words of wisdom to them. Specialist Daria Voronova had the opportunity to speak with Dingle about her continued growth as a soldier.
I really like that he asked me about my education, that he gave me advice.
Voronova, a native of Russia, has her degree in law and plans to further her education. After speaking with General Dingle about the Green to Gold program, she is interested to mull over this unique route. Dingle and Brady were at Wynn for a limited amount of time, but they made their rounds to many of the departments at Wynn. Dingle touched on the importance of being an engaged leader, learning something about each of the soldiers he engaged with during his visit.
You can tell the maturity in our soldiers just when you talk to them.
To close out his visit, Dingle recognized a few MEDAC soldiers and civilians with his commander coins for their continued effort to the quality and safety of the soldiers and beneficiaries at Wynn. Dingle's visit to Wynn is his first to the facility since becoming the RHCA Commanding General in March. For Wynn Army Community Hospital Public Affairs, I'm Zach Renstrom.
In related news, Wynn Army Community Hospital Specialist Gloria Roberts realized her instrument count was off during a procedure, so she spoke up. Her attention to detail ensured patient safety. Brigadier General Dingle recognized her attention to detail and commitment to patient safety during his visit to Wynn. And finally, the health of our four-legged friends has a direct effect on the health of our soldiers and families. Ronald Harris shows us another side of medical readiness in this report from the Veterinary Clinic at Fort Belvoir, Virginia.
A major part of the Vet Service's mission is to maintain the health and readiness of all military animals and working dogs.
The readiness of the military working dogs goes hand in hand with my readiness as a veterinary corps officer.
The care of non-military animals not only serves military families, but it is a valuable training tool for Army vets and veterinary technicians.
If we have happy, healthy pets that are in happy, healthy families, I think that's good for everybody. And every time I see Bichon Frise that's in here because it's itchy, well, it's not a military working dog that's itchy, but it's still a canine that's itchy. And that mental rep and that work that I do on that dog is going to be one more experience, one more little notch in my tool belt on how to maybe potentially treat a similar condition in a military working dog downrange, and those are invaluable.
The health of our military personnel, both home and abroad, is in their hands as well. The Vet Corps does food inspections not just for the Army, but for all military services.
There's readiness in everything that we do, and it starts with the food mission. We have our 68 Romeos, our veterinary food inspectors out there on the front lines inspecting the food that comes into the commissaries, not only for quality to make sure that the government is getting what it pays for, but for safety, doing routine laboratory, surveillance laboratory tests on that food to make sure that it is safe and not contaminated with any bacterial or viral pathogens, mold, and other insects, pests, anything that you would be concerned about.
Regional veterinarians also assist in response to natural disasters. These professionals enhance safety while supporting the Army mission and the Army family.
That's the Regional Health Report for July. Join us next month for another show highlighting healthcare across the region. In the meantime, don't forget to check us out on Facebook, Twitter, Pinterest, and YouTube. We're also on the Army Medicine channel of the Defense TV app. Thanks for joining us.